Hello viewers, this is Varsha Gore, Senior Clinical Dietitian, Apollo Hospitals, Navi Mumbai. The topic which we are going to discuss is about fatty liver disease. Diet and fatty liver has a significant role because it's diet and lifestyle which really matters and is going to take care in long run. Talking about fatty liver disease, it was initially thought it's only the alcoholic fatty liver disease, but not so because it is affecting younger population, young children, and even ladies. So the risk factors or those who are most prone to get fatty liver disease are those who are overweight or who have gained weight recently in a rapid way. Then those who are pre-diabetics are those having abdominal obesity. Your weight may be normal, but you may have a waistline which is much higher, near to 35 to 40 inches. So these are the most alarming factors where you need to care for and take immediate preventive and curative measures. Diet, as I said before, you need to look at your ideal body weight. So when you're talking about weight, we have to think about your calorie consumption. So these calories have to be balanced from your carbohydrates, proteins and fats. So when you talk about carbohydrates, we always hear that complex carbohydrates are good. But why they are good and why refined ones are bad? Because refined ones like maida-based foods, they are processed, they contain a lot of fats, they contain trans fats, saturated fats, which have a damaging effect on liver. Moreover, the whole grains such as our wheat, jawar, bajra, ragi, oats, they are much healthier. The way they are cooked, they require lesser oil, and then the consumption of vegetables is also increased multifold. So consume whole grain cereals. Along with it, concentrate on lot of fiber which you can gain through your vegetable sources. At least 5 sources or 5 portions of vegetables are best recommended. We can also go by the color coding of green, white, yellow, orange, red, purple, because these vegetables will not only offer you enough fiber, but they will also add a good load of antioxidant and functional food effect to protect your liver. Next, we talk about fats. Fats is always a risk for multiple diseases and especially for liver because it's getting into your digestive system. The type of fat, the quality of fat and the quantity all are important. MUFA and PUFA, that is monounsaturated fatty acids, is the one which you get from your vegetable oils. So when you choose your vegetable oils, suggestion is that you use variety of oil, rotate it over the monthly basis rather than having only one oil over the years. Second, the quantity of oil. Recommended to use 3 spoons or roughly around half a liter of oil per month per person on an average. This will ensure that your liver stays healthy. Avoid frying food because in the recommended 3 teaspoons of oil, frying is just difficult. And second thing, when you fry or when you are eating outside food, very often we find that oil has been reused and reheated multiple times, and this results in changes or trans fats and decomposition of fats, which is really harmful. If you really want to choose the crunchy or the crispy texture, what you get in fatty foods, you can offer other cooking methods like you can offer grilling, toasting, air fryer, or having a shallow frying so that you get the crunch taste with low calories and without any damage of oil. So in all, just to wrap up, take care of the total calories you consume, maintain the healthy weight, include adequate amount of proteins. Vegetarian proteins are the best. If you choose animal proteins, let it not be a fatty foods source, that is like your salami, bacon, ham. Eggs can be taken if your lipids are within the normal limits. Egg yolk, one or two, as per your clinician and the dietitian advice is good. Include variety of fiber and limit your fat intake to at least 2 to 3 teaspoons per day. So all these pointers will really take you a long way to take care of liver. Thank you.